brings us to your weekly capsule of health information. We like to call it your Healthy Dose, brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group. This is spinal care. I like the way you put that, Greg.
Thank you.
Yeah, you're welcome. We're talking about spinal care, and we're talking about the Spine Center, and joining us here is Amanda Wassman, who's Physician Relations Coordinator at Hannibal Regional Medical Group, joining us here in the studio. Good to see you, Amanda.
Good morning.
Thanks for joining us here.
Thank you.
So tell us a little bit more about the Hannibal Regional Spine Center.
Okay, the Hannibal Regional Spine Center is a relatively new service that's being offered. And what it is we know that many patients in America suffer with lower back pain or back pain in general. And what we've done is put together a service that will address that pain for patients who either don't know where to turn or who have sought help in the past and have not gotten the results that they've wanted.
Basically, in a nutshell.
Basically, a very generic nutshell.
Avoiding surgery.
Not necessarily. When you would come to the Spine Center for whatever reason, whatever symptoms you're having, you would be met with a provider who would address your symptoms. Based on those symptoms, she may send you to pain management to start with some injections or something of that sort. She may send you to physical therapy to start with some therapy options. She may say that you need to do more stretching and more exercise, and you may try that for a period of time. Or you may, based on some testing that they will do, you may be a candidate for surgery, right out of the gate. But a lot of times there's a lot of steps that you need to go through before you would necessarily meet with a spine surgeon. And for many Americans, when you have back pain, you're not sure where to turn first. And a lot of times you may show up or make an appointment with a specialist who's not the most appropriate person for the symptoms that you're having in your back. And so this center is basically designed to coordinate the care that you need and to get you in the right direction without maybe wasting the patient's time or getting them having the appointments that aren't necessarily needed.
Gotcha.
Amanda, I think you brought up a really good point, because a lot of folks don't seek treatment because they don't know what to do about it, or maybe they don't realize they're dealing with more of an issue than what they've got going on, just some back tension or something like that. But you also mentioned that they've sought treatment before and weren't happy with the results. This is a good time to go back and revisit that.
Possibly, yes. A lot of times you may have surgery and you just don't have the results that you were thinking that you would have had from that surgery. So Dr. Raul Basho, who is an orthopedic surgeon, who's the medical director of the Spine Center, is very happy to talk with you and look over the results that you've had from the surgery, the type of surgery that you had, to go over some diagnostic testing with you to see if there's anything more that can be done, or to see if maybe there was something that should have been done initially that maybe wasn't done, or to look at your options with you. And you talked about how people will come because they don't know what to do. A lot of people also will not seek care for back pain because they feel like their only option is to have surgery, and they're scared of that option because that's a life-changing event, and that's a big event. What we want people to understand also is surgery is like I said, a life-changing event, and there's a lot of steps that you would go through before you would make that decision to have back surgery. And that's why the Spine Center works together collaboratively with physical therapy and pain management and all of those different providers to make sure you're trying every step of the way, trying every option that you have before taking that leap into a back surgery.
Maybe you just need Pilates or something.
Possibly. Everyone could use a little more exercise.
You don't know, yeah. But there are ways to prevent back pain.
There are ways. Obviously, getting up and moving. Like I said, everyone most generally could use a little more exercising. And people ask, well, my back hurts. I don't want to exercise. But, if your back's hurting or you're having trouble exercising, on the ground, try some things in the water, try some swimming, some water aerobics, that kind of thing. Walking. Dr. Basho, I've gone many times with him as he's spoken to different groups, and he will just say, walk, walk, walk. Just make sure you're walking every day. Get up and get moving. Also getting regular checkups with your primary care physician, because they can maybe catch something early on that doesn't turn into, a larger problem. And then losing weight goes kind of along with the getting more exercise. that also would help with heart disease, diabetes, and high blood pressure. So not just necessarily your spine care, but just overall losing weight helps with your health. And then practicing good posture helps alleviate some of the stress that you have on your spine. And then resting easily and properly. So getting enough rest every day will help alleviate some of the stress that you carry on your back during the day.
Yeah, probably the most important of all that is just to get up and get moving, move around, get that exercise and get stronger.
So that and then you don't, I work at a desk all day long, and so every now and then just standing up, even if you're still at your desk, just standing up for a little while and just getting in a different position and moving and kind of stretching a little bit and so you don't get stiff and you don't get sore in those areas in your back.
It all helps.
All right, so there's a lot of things that we can do. You do treat a varying number of problems with the spine, all the way from the back of the neck all the way down to the little tailbone.
Correct. Obviously, if you've have a trauma where you've hurt your back, we don't want you to wait to see the spine center. We want you to go to the nearest emergency room. But if you have arthritic conditions in your spine or just general back pain and you're not sure what to do, if you know that you have disc degeneration or herniated discs, we can see those. If you have spinal deformity, spinal tumors, or a failed spinal surgery like we talked about, if you know you have scoliosis or spinal stenosis, those are also things that you can come to the spine center to be seen for.
Okay. And I know you have a lot of outreach programs that are available, seminars that are held throughout the year. You got one coming up on August the 12th.
We do. We actually have two coming up. The first one, August 12th, is a community event, and it's treatment options for the back. And Dr. Basho will be speaking at 6 o'clock on August 12th at Tony's 2 here in Quincy. And that's a free event for the community. We are asking that you call to reserve a spot just so that we can plan, accordingly and plan for food.
How many spines will be there?
How many spines he'll need to talk about. You can call 844-HRH-BACK, so 844-HRH-BACK to reserve a spot for that community seminar, again on August 12th at 6 o'clock at Tony's 2. Then on August 19th, we are having, and this is the first time we have offered a seminar for employers to come and talk with Dr. Basho about how they can address back issues in the workplace. And that's called Prevention and Treatment Options for Workplace Back Injuries. So we know that businesses annually can lose billions of dollars in loss of work productivity and treatment and disability payments. That can stem from a back injury. So Dr. Basho is willing to talk with employers to see what they can do to help keep their team members healthy, proper lifting techniques and that kind of thing. That event is August 19th at noon, and it's at the Quality Inn and Suites in Hannibal. And again, if you're an employer and you want to register for that, you can call 844-HRH-BACK, HRH-BACK. Okay.
A lot of great information there. And how do we contact the Spine Center?
Again, Spine Center's number is the same number, 844-HRH-BACK. Very easy, very simple.
I was going to say, yeah. That's wonderful. And of course, there's a lot more information online too.
Correct. At the Hannibal Regional website, there's information there as well.
Okay, excellent. Lots of good things happening there, and we're privileged to have a Spine Center right here in the area.
It's wonderful. We started in June, and it's really taken off, and we're glad to help people.
That's all right. Okay, great information, Amanda. Thank you very much.
You're welcome.
Thanks, Amanda. Real quick, how do you have such great nails?
Oh,
yeah, they look like lifesavers.
They do. They're very colorful, aren't they?
You did that all by yourself, right?
I did. They're actually stickers. So, yeah,
very nice.
I'm not that talented.
Stickers. Oh, you just ruined it for me.
Yeah. Sorry.
That's okay. We still love you. Thank you, Amanda.
You're welcome.
Amanda Wassman, Physician Relations Coordinator at Hannibal Regional Medical Group. If you'd like more information, you can go online. The folks who bring you the program, Healthy Capsule of Healthy Dose, Hannibal Regional Hospital and Hannibal Regional Medical Group.